Alright, my dear learners, you're welcome to our 20th lesson. I hope you're doing well. By God's grace, we are coming to an end of the topic circulatory system in humans. By the end of the lesson, we are expected to identify causes of blood pressure, to identify ways of managing blood pressure. Remember, we talked about the meaning of blood pressure in our previous lesson as the pressure exerted on the wall of the arteries by blood circulating through the body. We also said that when this pressure becomes high, we have what we call hypertension or high blood pressure. And if it's low, we have what we call low blood pressure or hypotension. So we'd like to look at the causes of blood pressure, since it is one of the deadliest silent killer. Alright, let's quickly make an overview of the chart on your right. The normal blood pressure, we said, is 120/80, where 120 represents the pressure of the blood as a result of the heart pumping blood. Then pressure of the blood as a result of the heart receiving blood or relaxing. That's the 80. So this is a normal body temperature. And if you fall within the range 90 to 120 for the pressure of the heart during pumping, that's systolic pressure, or 60 to 80 for pressure when the heart is relaxed, you say you are having what we call the ideal blood pressure or the normal blood pressure. Now, looking at the chart carefully, you realize that from 120 onwards, we have the pre-high blood pressure, that is 120 to 140. Then the danger has to do with 140 and above. Also, the diastolic, when the heart is supposed to relax, the pressure from 80 to 90 is pre-high, then 90 to 100 is abnormal, that's high blood pressure. However, when it comes to value from 90 to 70, then we have the low pressure of the heart during pumping. Then 60 to 40, we have low pressure of the heart during relaxing or receiving blood. The question is, which category do you fall into? And whatever category you find yourself in may have good or bad effects on your health. Now let us pick high blood pressure and find out the causes of it. So we are saying, what is the systolic and diastolic values of high blood pressure? From the chart, above 120/80, 120 and above, and 80 and above, you attempt to have high blood pressure or hypertension. Alright, let us look at the causes of high blood pressure so that we can live a lifestyle to avoid the dangerous causes. We have one, obesity. Obesity is as a result of increased accumulation of fats below the lungs and around the internal organs, leading to overweight. That tend to have pressure on the blood vessels and the heart, leading to high blood pressure. We also have what we call sedentary lifestyle or lack of exercise. Sedentary lifestyle or lack of exercise. As a expression suggests, regular exercise tend to cause blood to flow through the blood vessels, removing any fats, clogs in the blood vessels and in the heart, thereby allowing free movement of blood through the blood vessels. So if you don't exercise, you live a sedentary lifestyle, that is staying at one place for long, you tend to increase the chance of high blood pressure through the body. Salt is good for the body. It is needed for regular activities of the heart, kidneys, and other organs. But much intake of it will tend to increase the pressure of the heart in pumping blood. So avoid taking much salt, especially the refined salt. The refined salts. Then much intake of fatty food. Again, when you take in much fatty food like fatty meat, dairy, butter, margarine, when you take much of this, you tend to increase the cholesterol or the fats substances in your blood vessels and in the heart, thereby increasing the pressure at which the blood flows or circulates through the body. So high intake of fatty food can also lead to high blood pressure. Stress, where you undergo anxiety or worry because of pressure of work or entertaining a lot of worries, can lead to stress, and stress will have adverse effects on heartbeat, increasing the pressure of the blood. Smoking too is not good for us, as it increases the pressure at which the blood flows through the body. Substances like carbon monoxide, sulfur dioxide, nicotine, that form part of these substances that are smoked into the blood, increases the pressure of the blood. Excessive intake of alcohol can also increase the pressure of the heart. Heredity has to do with transmission of characters from parent to offspring. Sometimes there's a family history of high blood pressure in a family. And so there's a likelihood that the children or offspring will also get the disease. Dehydration has to do with inadequate intake of water. So not taking enough water can increase the rate of pressure. Old age, as one grows, the activities of the heart, decreases. And that also increases the pressure of the blood. All right, my dear learners, you can have time and go through this. We have more courses, but these are the major ones. Let us look at causes of low blood pressure. Low blood pressure. Now, what is the systolic and diastolic values of low blood pressure? Good, it is less than 90/60. Now, let's look at some of the causes of low blood pressure. Blood infection. When the blood cells becomes infected with disease, there's a likelihood that don't carry out the oxygen to the cells. The cells do not get enough oxygen. And activities of the heartbeat also lowers, leading to low blood pressure. Malnutrition. One of the important nutrients, potassium, helps regulate heartbeats. Not eating adequate food nutrients like spinach, the green vegetables, the red vegetables, fruits, you will lack this important nutrient needed for regulating our heartbeat. So malnutrition can lead to low blood pressure. Underlying heart problems like heart attack can also lead to low blood pressure, where the heart do not pump and receive blood normally or properly because of some underlying health problems of the heart. Then excessive use of drugs. Oftentimes, people are on medication, using drugs, excessive use of drugs to cure other diseases of the body. Now, in an attempt to do this, we tend to lower the activities of the hearts, and that leads to low blood pressure. So excessive medication can lead to low blood pressure. Then excessive bleeding, maybe as a result of accidents or whatever, where the victim loses much blood. This can result in low blood pressure. Diabetes is a disease associated with the inability of the body to regulate blood sugar. So excessive blood sugar can lower the pressure of the blood and even the heart. So diabetes can also lead to low blood pressure. We identify excessive intake of alcohol under under high blood pressure causes. The same cause is for low blood pressure. Dehydration too, the same thing, also leads to low blood pressure. Again, spend time to go through the causes of low blood pressure. Now, let's find ways of managing blood pressure in general, especially high blood pressure. How can we manage high blood pressure? So looking at the causes, we just pick some of the causes and reverse them to get a way out of managing high blood pressure. So the diagram here shows some healthy food that you should include in your diet, vegetables. Now this skipping rope and this muscle pulling device all help to manage blood pressure. So now let's look at some of the ways of managing blood pressure. Good, regular exercise. So avoid sedentary lifestyle and exercise regularly to cause circulation of blood throughout the body smoothly. You should also have adequate rest. One way to conquer stress is to have adequate rest. And then consume more fruits and vegetables as they supply essential nutrients that regulate our heartbeat, preventing high blood pressure. Then live a life free of emotional stress. As I said, live a life free of emotional stress. Avoid stress, okay? And avoid intake of much salts. Regular intake of water or adequate intake of water. You should avoid smoking. and avoid taking alcoholic drinks. And above all, attend regular medical checkup where your blood pressure can be what? Checked, and the appropriate advice will be given to manage any underlying blood pressure in the body. You can also buy the sphygmomanometer, the instrument used to measure blood pressure, and use it at home to check your blood pressure. Alright, my dear learners, this is what time will have us with this lesson. Try and read on reproductive system of humans. For our assignment, we have 5 causes of hypertension, 3 causes of hypotension, 5 ways of managing hypertension, and state the systolic and diastolic pressure values of hypertension and hypotension. I wish you the best. Till we meet again. Bye-bye.